Drinking Barbie at the same time.
I'm Buffy Garber, and I live here in Denver. I'm 32 years old, and for most of the past 4 years, I've been home with my daughter, doing some odd jobs and working at a public library. I was on Medicaid when we first moved to Colorado, and then last year our tax returns, I think, were $12,000, and that they said we made too much for me to stay on Medicaid. And mostly I think, oh, I'm sure I'm fine. But, I have a mole that I think, oh, did this really still look this way? And did this look this way before? And just little things that I would kind of like to just go and keep doing the preventative care. If I get a part-time job, is that going to be just enough for them to say, oh, you make too much, and take away my 4-year-old's Medicaid? And that gets really scary really quickly. I felt stuck when I realized that. Sometimes people say, well, if people would just get jobs, then this insurance thing wouldn't be a problem. And, it's all these people who are sitting around doing nothing, and that's their fault for not having insurance. But I'm really worried that I may get a job, and that will be why my daughter no longer has insurance. You have to send in very detailed proof of your income, proof of your citizenship. There's a really detailed list of all of the things you need to photocopy, some of the things you have to have notarized. Send it all in, wait on pins and needles, and then if you get recertified, by that time it's almost time to start collecting it all again. It feels punitive since you don't have your own health care and you're asking us to do something about it. Like, you need to jump through these hoops and, well, what did you spend on this? And it feels like it would be a good thing if people who didn't have health care didn't feel like they had done something wrong.